Now, live, Local 2 Saturday morning.
Well, welcome back. Laser hair removal is becoming more and more popular with both men and women, but there are dangers some people may not be taking into account when signing up for that procedure and paying for it. With more on this, we're joined by Dr. Shalina Lalji. Good morning to you, Dr. Shell. Good friend
morning,
of
Courtney.
Local 2. Great to see you back on the show.
Great to be here. Thank you.
You know, laser hair removal, we said, is common for both men and women.
It is.
But there's a different kind of laser, right? When you're choosing, I mean, is there
That's
something
right.
that we need to know about that?
There is a lot that we need to know, Courtney. To begin with, there are different types of lasers, absolutely. There is a true laser, which is a single wavelength, and then there is an IPL, which is really not a true laser. An IPL can be used to perform laser hair removal, but it's not ideal in a lot of different candidates. Okay. And so if I can expand on that, you really need to focus on an individual regarding their skin type, whether or not they have tan skin, what color hair do they have, and those are the different variables that really need to be taken into account to determine what kind of laser should be used.
And so, you know, wanting to get rid of that hair is always something that a lot of people want to know
You're
about.
right.
But not everybody's a good candidate then.
That's true. The thing that determines whether you are or not a good candidate is, again, you know, whether or not your skin type is appropriate. Now, there are lasers out there, and to name one, Cutera's 1064 wavelength laser is both safe and effective on all skin types, okay, whether it be the lightest skin or the darkest skin. So you're absolutely right. You have to be educated. You have to know what your skin type is, and you have to really go in for an individual consultation so that the physician or the individual that has the most expertise can tell you whether you are a good candidate and which laser should be used on your skin.
And, you know, we kind of touched on this a little bit, that, you know, that things can go wrong. And as a physician, you've seen some things that
Sure.
clients have come into your office
Sure.
with some bad experiences. And
right.
really, I mean, it seems like everybody's advertising this lately.
You're right, and you have to be careful. As a consumer, you really need to not look for those discounted laser centers, only because you want to go for safe and you want to go for effective. So just because you go for the least expensive, you're not going to get the results that you want, and you might end up getting injured. The thing that I always caution my patients and other patients on is that look for a center that has a medical director on site.
Okay.
Very important, because setting the parameters is crucial, and you really want somebody with the appropriate training and expertise to be setting those parameters and supervising the procedures, taking into account the person's skin type, the person's tanning history, and the type of hair that they have.
And we're talking multiple procedures, so it's not just
right.
a one-time visit in the office.
It's not. It does take several sessions, and the reason for that is because the laser actually permanently disables the hair follicle only in the growth phase.
Okay.
And our hair is in different phases at different times. So it will permanently disable those particular hair follicles, but it needs to then go after the other hair follicles that are in the resting phase at that time.
Okay, and I think we have a photo of a chin
yes.
area. Let's take a look at that, and you can
sure.
talk to us about that, Dr. Shell.
This is a lady with a chin area, and you know, a lot of women, especially as they get into their 40s and 50s, because of hormonal changes, start growing hair under the chin. And that's something that is a sensitive area and really needs to have the appropriate settings.
What does it feel like?
It feels like a slight pinch. Most of the times it feels like a little rubber band snapping, and it really isn't painful. Okay. I would say it's slightly uncomfortable, but most of my patients will say that it's much less painful than waxing.
Okay, and then what you've seen come in the office, are they burns when you've seen this kind of go wrong?
Unfortunately, yes. You can either have burns, we've seen those. We've seen also hypopigmentations, which is darkening of the skin or lightening of the skin. Fortunately, that's usually temporary, but could take up to several months to clear up.
Oh, great advice. Dr. Shell is out of Sugar Land, and I'm sure a lot of folks are going to be...
Actually, go in for an individual consultation. I cannot stress that enough. Go in and get an individual consultation to see if you are a good candidate and which laser should be used on you. An IPL should not be used on darker skin types, Courtney.
Great. Thanks so much, Dr. Shell. Great to see you this morning.
Thank you. Great to see you.